Charlie Mike, the podcast. Veterans helping veterans. Talking about things happening in the veteran community. Things we've experienced and overcome, such as addictions, PTSD, depression, legal trouble. And we also promote veteran-owned businesses. If you're talking about it, we're talking about it. This is Charlie Mike, the podcast.
Yo, what's going on, everybody? Welcome back to another episode of Charlie Mike, the podcast. As always, I'm your host, Raul, and your co-host, William.
What's going, y'all? Good to be back. Getting in the swing of things. It feels good.
It does. It feels good. We're definitely getting a routine together,
Yeah.
It's coming along very well.
It is. And now some of the episodes that we have recorded are getting ready to come out. And so it's a little surreal. It is to like, hey, man, I remember recording that one. Or, hey, this feels so good to actually get that one out there. Like we've been sitting on some of them.
We're getting the ones recorded that are in the studio finally.
Yeah.
We're having guests in, and it feels amazing. It's a different feeling.
Yeah. And, we may have like 5 views and one's mine and one's yours, but it's like, you know what? That sound quality is good. that quality right there is A1.
One thing I noticed about you, man, is that you undersell everything.
I know.
And it's funny because you don't know like the analytics part of it.
Yeah.
And that's where I come in, and I'm like, man, you couldn't be further from the truth when it comes to numbers.
Yeah.
But yeah, I like that about you, though.
Yeah, what's funny? So, like you said, for me, it's all about building the relationship. And I feel like I can go really deep when it comes into the relationships. And I'm like, that connection means a lot. And then Raul was like, no, man, like we actually did really well this past month. And like, for real? He's like, yes. And I'm like, well, good. Because it's not about, the analytics so much. It's about the connections.
I think that's how we work real well. Front of the house, back of the house. Yeah,
exactly.
So as y'all can tell that we have a guest in the building.
Yes. And so our guest is Dr. Drew Helmer. And I first came across Dr. Drew. Is that okay?
That's fine.
Yeah. All right. So first I came across Dr. Drew was when the PACT Act came out and the VA had a resource for almost like, hey, this is all that's going on. And it was right next to the VA down here in Houston. And I said, how can we get somebody on? And it takes a little time, right? Because it's big army, big government, and we're here now. So this is the first time that we've had someone, I guess, of your education, right? To kind of help bring us in and understand the nuances of what is going on. And so I want to make sure to be clear that Dr. Drew's opinions are of his own. He's not here representing the VA. Okay. He's here representing himself and the studies that he does. And I just think it'd be a fun conversation to kind of dig into it and get into the nuances of what it is you do, what it is you've learned, and to kind of hear more about your own story. Because I think that's key. I think for a lot of us, it's about the stories that really bind us and connect us. And clearly you have a heart for servitude. You have a heart for veterans. And so I'd like to kind of get into that. So could you give us a brief, 1,000-foot view of your background and how you ended up here with the VA?
Wow, 1,000-foot view. So yes, I'm a physician. I'm a general internal medicine doctor. And so that means I do not surgery, not kids, not gynecology, not babies. Anything related to an adult is kind of what I take care of. And, I didn't always know I wanted to be a doctor. I actually was really interested in science and that sort of thing, and kind of realized in my undergrad career when I was getting my bachelor's degree that being a doctor might be a very good way to keep my options open and do something helpful. Right. And so that's kind of what got me into medicine to begin with. I think I always knew I wanted to do more than just medicine. I always knew I thought initially I wanted to be like one of those infectious disease doctors who goes off and fights the viruses in Africa and kind of, an epidemiologist. And so I applied to medical schools that offered both the medical degree and something else. So like a business degree or a public health degree or something. And I think you're going to see that this theme kind of continues to my life today. I really have this very big picture approach to life. I like the big picture. I'm a generalist. I like to see the differences and the different opportunities. And so I ended up going to medical school and got a master's of science in health policy and management, thinking that I might do something in business or maybe something in research, but wasn't really sure. And then I had an experience with business. I had actually did an internship with a managed care organization and realized that I needed information. I needed facts. I wanted to know the
Hmm.
answer, like just kind of flying by the seat of your pants. And the CEO that I was working with at that managed care organization was like, "Oh, just go out and find some information about provider. How do you grade? How do you evaluate a provider performance, a doctor's performance?" And I was like, this was in the 90s. I was like, well, there's really not a good set of criteria. It's really kind of vague, and people don't really know what's the best way to do this. And he said, well, it doesn't really matter. We're just going to withhold 15% of the physician's salaries if they don't meet these grades. I was like, oh my gosh, that's horrible. Like you can't keep people from getting their salaries based on some numbers that nobody knows if they're accurate or not. And then he's like, oh, they won't care. And I was like, of course they're going to care. And he was right. They just went ahead and said, hey, that's good enough for business, and we'll do it. And at that moment, I kind of realized I want to know the answers. And so I did residency, and my first job out of residency training. So you do undergrad, you do medical school, and you do your residency. And my first job was actually working at a VA, a war-related illness and injury study center at the VA in New Jersey. And I realized that I would have this opportunity to work with veterans and really answer some of the questions that I think everybody has wondered about, since Vietnam and before that. Did my service actually have an impact on my health?
Hmm.
And how did it have an impact on my health? And so I've really enjoyed over the years trying to find the right answers and exploring them. And that's the research part of me, but also kind of keeping my fingers in a bunch of different activities so that I can have an impact, make a difference, get the information out there where it can be used. And so I think that's kind of how I ended up where I am today without going into too much detail.
Right.
Yeah.
Right. And what I hear is very interesting too. You go to school and you think that you're on this path. I mean, a lot of veterans do the same thing, and then when you get out or you actually start to apply it, it's not what you were thinking, And so there is a little bit of change where we have to kind of change courses for us, right?
Oh, absolutely. I think every day, every my plan for every day changes. By the time I even get into the office, it's like, oh, I guess I'm going to be working on that today, or I'm gonna have to address that first before I can get on to what I thought I was going to do today.
I love.
Absolutely.
And so you started in New Jersey. What's one thing that you've noticed is different compared? I mean, from like that was the 90s, correct?
New Jersey was 2001.
2001. Okay, so 2000, some early 2000s, and now here we are, 20 years later. So you've been with the VA system this entire 20
Yeah,
years, huh?
yeah,
And generally, we were just mentioning before the show, Raul and I have both had great experiences at the VA at this one here in Houston.
great.
And so, have you noticed that as well? Have you noticed the progression of the VA care and I would say, like the satisfaction increasing?
Yeah, once again, kind of from my perspective and my experience, I feel like the VA has, as a person who works at the VA, there have been moments in the last 20 years where I was kind of embarrassed by some of the headlines that were out
Mhm.
there. But my own experience trying to help veterans and trying to connect veterans to the other services, as a generalist, I'm kind of the guy who connects veterans with, more specific needs to the people who can address those needs, whether that's a social worker or maybe a psychologist or maybe a surgeon of some sort. Like I identify the problem, I define the problem with the patient, we create a care plan, and I connect them, right? So I feel like over the years, it's gotten easier to make those connections and make sure that those connections get, kind of, they really happen and that the services get delivered.
Someone come to you and they're a broken person,
Mhm.
not maybe mentally, maybe physically. And have you ever had the experience where they come back and like, hey, doc, thank you. You know,
Yeah, yeah, yeah. I mean, I actually, so I did primary care for the first, I guess 11 years of my professional career where I was the doc, right? I was the guy that the veterans came into regularly for their primary care. And I did that both in New Jersey with just kind of a general medicine panel of patients, so veterans of any era or, deployment or non-deployment. And then when I was in Houston from 2007 to 2011 doing primary care, actually at the post-deployment clinic here at Michael E. DeBakey, I focused more on recently deployed combat veterans, especially those who were seriously injured. Over the years, I've actually gotten to know my patients very well, and
Yeah.
I'm still in touch with many of them,
Right.
like on a more personal friend level than, because I don't do that primary care thing anymore. And yeah, so I've had veterans say,
Let's,
yeah, I came in and I talked to you about this, and look at me now.
Mm.
yeah.
Yeah.
Can you speak to the importance of the social support for veterans and how that can kind of positively affect their post service?
Yeah, I think I recognize that really early on, especially when I was doing the primary care for the recently returned combat veterans. I trained as a physician, so I learned how to diagnose and prescribe medications and, make referrals to specialists for specialty care and coordinate that care. And certainly when I was first in that role with this specific group of people coming back from deployment, from combat, mostly young,
Hmm.
mostly men, but 10 to 15% women, right? Yeah, I'd go through kind of the medical history. Nope, I don't have any diseases. Nope, I don't have any surgical problems. I mean, it was all about education, job, family, and connection, right? And so I realized, pretty quickly, I think that as a doctor in that role, I needed to adjust and actually needed to learn a lot more about social support options that are available in the community. Because the VA does many things very well, but we can't be everything to everybody in terms of social support. And so it was really important to me to find good community partners to connect veterans to, whether it was a family related service that they needed or perhaps, just a social outlet because they were new to town. Houston has been a magnet for separating service members for decades, right? Because we have jobs and we have opportunities.
Yeah.
And so people would separate from, military service and make a beeline to Houston, and they really needed a place to connect. And because we don't have a base, we have Ellington, we have, military facilities, but it's not like San Antonio
Right.
or other places where there's a big military presence, a visible presence, right? So I think there was a real challenge for many people coming in, and as the doc in the post deployment clinic, I would see we tried to make that the front door for the VA, so that you could your first visit in, you'd come in and you'd see me as the doctor, you'd see a social worker, and you'd see a mental health provider just to make sure everything was on track. And we really wanted to make sure then that we could also say, well, here's an organization you might want to check out, or here are some
Yeah.
options in the community that you should think about, so for you, your spouse, your family.
Hmm. I think they're doing a good job. I know everybody gets emails, right? And the VA does a pretty good job of sharing the variety of resources that are out there. I know I see them, and they're just getting better. I see all the resource fairs that are going on, and I see a lot of folks in the VA being involved. So I think it's important because we have a lot of nonprofits come on here and share their stories. But I love to hear that from the VA too, because when I think of it big picture, like that's one of the first things we all ask a veteran, where you connected with the VA yet? Like we got to somehow get you connected. And although the VA isn't the main source for all of it, it's great to see that they're sharing resources. And it is really important for veterans to get connected to other veteran groups, not
Mhm.
just the VA,
Right.
for that social aspect,
Mhm.
because it's the entire body.
Mhm.
Yeah, and I like the fact that they're out there trying to change what other people have experienced. Like, not every organization is a bad organization,
Mhm.
or you hear nothing but horror stories about different things. Doesn't mean that you're gonna have the same experience or something along those lines. And like we spoke before, we've had nothing but amazing experiences here at this VA. And now when I tell people I love the VA, there's some veterans that look at me like, "What?" You know?
Right.
But it is that's what I've experienced.
Yeah, and I think it goes more to about our Houston community. You did mention it that we don't really have a large base, but when it comes to population wise, Houston has got like number 2 for veterans.
That's right.
And it's like we don't self-identify. You know, nobody says that they're veterans. I mean, there you have those folks that will wear their affiliation, and so, but it goes that way. It's like, how do we get better at making sure that we see each other?
Hmm. Yeah, and certainly one of the things I'm kind of fascinated by the veteran identity question, right? Because in order to go to the VA, you obviously have to be a veteran, you have to be eligible. But I think part of going to the VA is accepting that veteran identity. Like you can't avoid it. If you're going to walk in those doors, there's like this, and I'm not a veteran. I wasn't in the military, but I just perceive that there's sometimes a reluctance to go to the VA because, well, I'm not a veteran. Yeah, I was in the military, but I'm not a veteran, whatever that means to that individual. And I think sometimes the community organizations can do it differently, and it can really adapt a little bit better to what that means for a former service member.
Yeah, I think I've seen that too, where someone says, "Nah, I'm not gonna go to the VA because I'm not a combat veteran."
Oh yeah.
You know what I'm saying?
Mhm.
And then you feel like, "Yeah, but you're a veteran,
Mhm.
Right.
so the
Or
VA is there for."
or I'm not injured,
Right, right, right.
or other people are worse off than I
Yes.
am. I mean, I
That's
hear that a
that's the
lot.
one.
That,
It's
that's a
like,
big one.
yeah, like
Yeah.
I don't need that. I've got a job, I've got insurance. I don't need that. I'm like, well, there's probably something there, and you've earned it, right?
Right,
So,
right, right.
And it's also the unknowns, like because you are so targeted. Like you did say you're not a veteran. We mentioned this, but it's also like, but you've spent so much time around them, right? Like that's your niche.
yeah, yeah,
That's your niche. That's your clientele. That's who you're passionate about serving.
yep.
And so because of that, you also know the things that we don't know. Well, have you considered this, right?
Hmm.
Or I mean, the whole reason why we brought you in too, we're really interested to hear more about, the burn pits, and the
Hmm.
PACT Act and the research that goes into it. And I'm sure there's a lot of veterans out there like me that don't really understand it all as well.
Hmm.
But that's the point of you getting involved with the VA. Because if you do come in, then you can ask somebody who is experienced in this, who knows a little bit more about what's going on.
Yeah. Yeah, absolutely. Nobody can know everything about the VA. It's just too big and too sprawling, and then things change, right? What you knew 2 years ago, 5 years ago, it does change, and sometimes that's because of a law, like the PACT Act, or sometimes it's, just policy or just people turn over. Not as often as you might think, but, people do move on in the VA too.
So let's talk about it a little. So I'm new. Don't know anything about the PACT Act. What is the PACT Act?
Well, I did write down the actual
Oh,
title
oh,
of the law so I
yes.
could get it right at least once during the podcast here. So it's the Sergeant First Class Heath Robinson Honoring Our Promise to Address Comprehensive Toxics Act of 2002 or 2022. So the PACT is Promise to Address Comprehensive Toxics. It basically does a couple of things. I'd say the most visible and veteran relevant things are it expands eligibility for VHA care. So more veterans now can qualify to get health care from the VA. And that's the most important, mm, piece of the act. And then it also expands benefits for certain toxic exposures or conditions that are presumed to be related to those toxic exposures. And so those are really the most important thing. And I think what people want to hear about. It also changes a little bit about the way the VA can hire people, and it adds, new sites for
Mhm.
care, but those are kind of more bureaucratic sort of things.
I put it all in there.
Yeah.
Put packages together.
Right.
Yeah, that's way above our level.
Well, and one of my interests is it actually expands research activities
Right.
and mandates certain research projects related to the military exposures. And so that's also, I think that's important, but
Yeah.
that's a little secondary here.
Yeah, you're kind of excited for it. Like, yes, now I can actually dig in further, right? Like find more
Yes,
truth, like
yeah.
get more, like you mentioned it, just getting more into the nuances of the actual numbers. Like, why is this happening?
Yeah,
What's
yeah.
actually going on?
Yep. Yep, absolutely. So I mean, some of the things that the PACT Act did is it named several other conditions that are now presumed service connected. And I think one of the this is one of the biggest this is going to be one of the biggest changes it made for Vietnam era veterans. It made hypertension or high blood pressure a service connectable condition. Well, about 2/3 of Vietnam era veterans have high blood pressure. So now that's still a large number of people who are now eligible for a service connected benefit that wasn't there before. And of course, that comes with enhanced eligibility for care and also a disability payment,
Mm.
a disability benefit. So that's going to be huge. For the other cohorts, there are other conditions that got added to the list as well.
And they've definitely earned every bit of it.
Yeah.
Those guys, Vietnam.
And I think it goes back to getting involved with the VA because that era too,
Mhm.
doesn't want a lot of help. And then even, the Gulf War folks, early 9/11 folks, it's like I don't need to go. But what I tell a lot of vets too is like it's not for today.
Mhm.
It's not for today. You're getting analyzed, you're getting
Mhm.
treated for the future,
Mhm.
because your body will wear over time. And like you said, high blood pressure and hypertension, if you have if you have it, it makes you more eligible for more care.
Mhm.
Now you can go get better. You can get treatment at the VA,
Mhm.
and for me, I feel more comfortable there.
Mhm.
I do. Like I have a primary care physician. I do have TRICARE, but I would rather go to the VA. I don't have to worry about anything else when I go there.
Mhm.
Mhm.
And there's like-minded individuals there. I feel comfortable because I have all my other veteran friends there. Everybody's pretty kind to me when I go in there. The
Mhm.
volunteers that are there. So I just feel that the opening it up to eligibility is also allows us to get treatment sooner.
Mhm. Well, and medications can be expensive, and
Mm.
when you have a service-connected condition that requires treatment with medications, the VA can be a pretty good deal. It certainly can be better than even your private insurance or your Medicare.
Yeah, you ever get those prescriptions where you look at it and it says without insurance it would have cost like leave.
Right.
Yeah. Yeah, I
Mhm.
do, and then being able to get it from the mail too, just little
Mhm.
Yeah.
things. I mean, I haven't had to go to the VA too many times out of the way to get prescription refilled. If I'm proactive in my own healthcare, then
Mhm.
it's really hands office, and that's the hard
Mhm.
part, right? Being
Yeah.
proactive in it.
Yep. That's me. I wait till the last one.
Yeah, I know. I've heard you on the phone many times. But what about today? I need it.
When did you run out? Yesterday. Golly.
So, in your experience, what are some of the most common challenges that veterans do face when they leave, right? So, from your eyes, when they leave the military and come back into the civilian force?
I think I guess I'll call it a vulnerable period for many people, right? I mean, that's such a major life change. Maybe you were in high school and then you went straight into the military, and you're now used to being in the military where your housing is taken care of, your food is taken care of. They fill your day with,
Yeah.
physical and other activities.
Mhm.
You've got a mission, maybe you deployed and had some challenges, and you're coming back and still kind of processing through all that. And then all of a sudden they're like, "Oh, your time's up, time to move on to that
Mhm.
next phase of your life." I can only imagine what a challenge that would be. And so I call that the vulnerable period. And I think that's one thing that, I would love to see us throw everything in the kitchen sink at people during that period to help them get through that with, the greatest of ease possible. Like it's just I just what are you going to do about housing? What are you going to do about employment? What are you going to do to finish your
Mhm.
education and get additional training? What if you have a spouse and kids already? How are you going to help them transition? So I think there are some efforts underway to really make it smoother at that point. Some of the stuff around not the PACT Act, but other recent bills have really identified that as a vulnerable period for mental health in particular. Like, we talk a lot about veteran suicides and these sort of things. So there's kind of two time periods where that's important. One is when you're an older person and maybe starting to feel isolated, chronic health problems, and across the population, suicide becomes more prevalent at that point in one's life. But for service members and veterans, there is a little spike right after that separation.
Yeah,
And
I've heard it said that first year is the most dangerous year. That
yeah,
first year for veterans.
yeah. And so I think around the mental health thing specifically, we've got more options now in terms of services we can provide and, kind of making everybody eligible for anything, including even if you need it, you can go straight to the emergency room and get assistance with the mental health crisis. But we could do more, I think, and we're starting to see some other programs that are really strengthening that handoff between the military and the VA and really trying to make the default of we're going to connect you to the VA unless you tell us you don't want to be connected to the VA. And I think that's very exciting because, it's very, like we said, it's very hard to know everything about the VA. It's very hard to sometimes even get introduced to the VA. It can be really challenging. And so if you kind of make it like, well, you're going to get signed up for care at the VA and we're going to make sure that you are connected and somebody's going to reach out to you and say, we're here. I think that would go a long way to making that transition a little bit easier.
Right. So 2 points that I want to make. First of all, if you are feeling that mental health crisis, if you are within that first year, there is a number you can call or text. It's 988. And of course, if you're a military veteran, press 1. So 988, press 1. And the second part was the strength in vulnerability.
Mhm.
We've talked about it before. It's like being able to ask for help. There's so much power there. It takes a lot of strength to ask for help. And then on the third thing too, I think there's a way that we can do a little more mentorship or sponsorships, right? That's what we used to call it in the military when we transfer. But a lot of folks don't take advantage of it as it is. Like if I were to go to a new base, did you ever sign up for sponsorship programs?
I think I did.
Like once, like
I-
randomly, because it was mandatory.
I think yes. When
Yeah.
I was a brand new private
Yeah.
and I first got to Fort Hood, Fort Stewart, it was mandatory.
Yeah, I think I did it at Stewart too.
Yeah.
And so I think there's something there, and I'm glad to hear that there is stuff like that because that would really helpful. And if anybody is listening, you guys can always reach out to us, and Raul and I are more than happy to talk to you about how to get connected and where you got to go, and we're here for you too. And I appreciate you saying that because I just think it's interesting because we know what they are, right? Because we've been through them, and for you to kind of observe some of the same things that we talk about, it's a little bit of like a validation. Like we're not the only ones that see
Yeah.
this, we're not in this alone either.
Mhm.
There's a lot of great people out there that are trying to make sure that veterans are getting the care that they need. And I can tell by our conversations, it's your passion for that. And I'm happy to have you here.
Yeah. Yeah. The one, so I'll just go ahead and name it. We're lucky enough. Our Houston Medical Center is one of the, I guess, kind of pioneer sites for a new program in the VA called the Veteran Sponsorship Initiative, which
wow.
is kind of what you're talking about. It's interesting because it's a public-private partnership. And so we're hiring a social worker who's going to be kind of coordinating and facilitating this activity, but it is definitely targeting separating service members
Mhm.
from Fort Hood in particular, because it's the largest point of separation for
Right.
for Army personnel. And our facility here in our community, I should say, not just the facility, but the community. And then they're going to be going to community service organizations to try to identify sponsors who live in the community who can
Wow.
really make it a warmer handoff, right?
Yeah.
So, once again, I think it's the VA can do some things to maybe facilitate or catalyze these activities, these connections, but we can't do all the sponsorship.
Yeah.
right?
Yeah, I
And-
think that's a big thing. Like you would say, like I've experienced this, so I know what you're gonna feel like, or you might feel like. So this would probably be the best. I mean, I suggest this, and
Yeah.
it's different coming from a person who experienced it than someone who hasn't, or something like that.
Yeah. And it goes back to what you said earlier about the VA being using as community partners,
Mhm.
right? We don't have to know everything. We don't. We've had a lot of folks on, and I can still
Yeah.
tell you that I don't know all the services or the organizations that are out there, which makes great content because we'll have more of them on. It's hard for any one person or any one channel to really cultivate all of this
Yes.
because even in the military, they can't refer folks to nonprofits, right? Because they're in the Army, but they have sponsors or FRGs that can.
Mhm.
Like, okay, well, I can say, hey, use this person instead. So that's exciting. I'll definitely be keyed in on where we can go, and I'll put it out there too. If there's any help that you guys need, feel free to use us as a resource. we're happy to put it out there, use our airwaves too for whatever it is you guys need help with.
Yeah,
We're
cool.
happy to partner somehow.
Definitely. That'd be amazing. With so let's so with as far as research with the
Mhm.
PACT Act. Now, is that something that you yourself did?
Yeah, so I've I've done a combination of clinical care, education training, and research. And my research focuses on military exposures and deployment related health effects. And so as a general internist, I focus more on the non the non-mental health
Mhm.
problems. So I've looked at things like traumatic brain injury, Gulf War illness. More recently, I've been looking at some of the pulmonary complications that might be related to burn pit smoke exposure and other airborne hazards. And then most recently, kind of not because of the PACT Act, but kind of in parallel to the PACT Act, the VA Office of Research is developing the Military Exposure Research Program. And so I'll be leading what we call the Data and Biorepository Commons, which is going to make it easier for researchers to find the data they need and find the specimens like the blood samples or maybe urine samples that they need to do the tests to answer these questions about what happens after an exposure and what can we do to fix the problem.
Mhm.
So what kind of role has the bacteria exposures or the toxic exposures played in the veterans like physical and mental health? And what's something that we can do to be proactive in treating that or being aware of that?
Yeah, the so when you read the scientific literature on military exposures
I've tried.
and
I have tried.
and the health effects, you're going to see all sorts of things like, well, there may be an association, but we're not sure if it causes
Mm,
this. And in other populations, we've demonstrated this, but we don't see that same thing here in the military service members. It's really messy. It's meaning there's a lot of opportunity to ask more questions and do more research, but it's really kind of it's a challenge to really answer these things to the point where we can say this is related to that or this causes that. There are a lot of so let's take smoking as an example, right? So it took years for people to realize that smoking causes cancer, smoking causes heart disease. Um, and smoking is pretty easy to track. You can see people smoking, you can do this. Think about the exposures that you might have had while you were deployed. Okay, so there's smoke from the burn pit, but how much of it did you actually breathe in? How what was in that smoke? I mean, a lot of that information just isn't available. They didn't go out and measure, what was in the smoke with any sort of regularity so that you could know what was there. There were some measurements, so we know there was some bad stuff in there, but we don't know how often that bad stuff was there, how much of the bad stuff was there, and certainly we don't know what each individual was exposed to.
mm,
So then we try to extrapolate from other studies or often from other populations, like the World Trade Center. That was the initial responders who were exposed to the dust and the smoke and those other toxins. In the aftermath of the World Trade Center catastrophe, they were tracked with great precision. I mean, they did all sorts of tests and really analyzed the dust and these sorts of things. And so we can learn a little bit from an example like that, where we can say, yeah, you know what, the sarcoidosis is more common among the responders to the World Trade Center, and maybe that's something that we need to look at in our military population as well. And so there are some examples where we try to take similar exposures or maybe a different worker type, somebody who works maybe in a refinery and is exposed to certain toxic chemicals or maybe solvents or something like that. And then we know that there are certain people in the military who do something similar and may have some similar exposures. So we try to understand, from similar groups of people, what might be happening. I think that the goal is that we can get a better sense of what the exposures were for military personnel, either kind of at a group or a location level, like at a specific base, what sort of exposures might have happened at that base, and then look and see what sort of health effects that group of people experiences over time.
Could you explain a little bit about what a burn pit is? And because in the research too, I've seen that it mostly said Afghanistan and Djibouti. And I do remember the burn or some version of burn pits in Iraq,
Mhm.
but I wasn't necessarily around them a whole
Mhm.
lot. And I think
I
that's
did
kind
too
of
in Ramadi. I
right.
also,
Mhm.
yeah.
See, and I think there's a little bit of nuance too, because I remember. So here's the difference too: is I remember at the smaller areas having to use the JP8 fuel
Mhm.
to burn the feces, and
Yeah.
it's like, is that something that qualifies as well? Or is that just different?
So I, I don't know who gets to own the dictionary that
Right.
defines burn pit here, but I take a pretty broad view of what it is, and I've done a lot of the burn pit registry exams, and so I just leave it open. So tell me about your experience. Tell me about what you were exposed to, and I hear that a lot. I think especially on the forward operating bases and other smaller installations, right? You didn't have a latrine, you didn't have the trash company didn't come by and pick up your trash on Tuesday mornings,
Yeah.
and so burning trash and burning feces is, really the standard way of taking care of that stuff for thousands of years. And so I think the feces in a smaller container, kind of smaller quantity, maybe less frequent exposure, and a time limited exposure is probably qualitatively different. I think what maybe the general public has seen about a burn pit are the more dramatic examples, like at Joint Base Balad, where it was, a massive area because there were 50,000 people living at that base at its peak, and literally tons and tons of trash going in every day. And it was just constantly burning, and they would have the dump trucks dump the trash, and the bulldozers would push the
Right.
trash around, and they would pour lots of accelerants, JP8, diesel, whatever was handy, and then it would just smolder and let off really thick, kind of really.
Rubber burn
Yeah.
Yeah.
smell.
Yeah.
Yeah,
Well, because they were burning plastics, they
yeah.
were burning batteries, they had to burn everything. And so there's nobody is contesting that it's toxic. It's just, how much of it were you exposed to, and were you exposed to enough to cause some sort of health problem?
Hmm. Interesting.
So,
Because that's for me, that was the biggest point of confusion, and
Mhm.
I appreciate you clearing it as best as you can. Right?
Right.
Nobody earns the definition of it, but so from what I hear too is if you're in doubt, get examined anyways.
Yeah. Yeah. Well, and because I'll say this too, right? It's not just the burn pit registry. It's the airborne hazards in open burn pit registry, because there are other airborne hazards, especially in Southwest Asia and in Afghanistan. The dust, my understanding is the dust was really fine.
Fine. Yeah.
And the wind would come up and you'd have a sandstorm, and you would be inhaling the dust. Well, that's not good for your lungs either, and it's not good for your upper respiratory, your sinuses, and your nasal passages. And so, kind of getting back to, so what do we see happening to people after this exposure? So we do see an increase. Well, I'll say an increased signal with regard to sinus problems and asthma and other obstructive lung diseases.
Hmm.
It's not everybody gets those problems, and it's really hard to scientifically say that it's caused by those exposures, but there's definitely an association. And we see it kind of using different data sources and across different groups of people. And so we think there's probably something real there, which is why the PACT Act came along and said, hey, if you have these conditions, we're going to grant you service connection for these, because, as it's, the language that they use in the VBA is, it's as likely as not that contributed to your health problem.
So the PACT Act was finalized in 2022, correct?
Right. Signed.
Okay.
Yeah. Last
So
August.
how long do you think? How long would you say that it was in the making? I guess is what is that something that you would be? I mean, if
Yeah. So I, like we said, I've worked for the VA since 2001. The first time I heard about the burn pit Actually, the first time I heard about an airborne hazards related lung disease was around 2010. I had had a couple of patients who were concerned even before that, but in terms of like, kind of the message riding up to the level of, hey, this may be a more widespread problem, I would say it was around 2010, 2011. Um, and No, that's not quite right. No, because we actually wrote a paper in 2007 from when I was in New Jersey before that actually reported a problem. Like people were concerned about their lungs and their exposures to the smoke. So it was at least 2007. And we were in Afghanistan from October 2001, and then went into Iraq 20 years ago, right? In March 2003. So kind of within the first 4 years, we did start to see a little bit of this, hey, there's a concern here and what's
Mhm.
going on. But there was a publication in a research journal in 2011 that really kind of said, hey, we think we found a problem with constrictive bronchiolitis, which is, a very specific entity that's you have to have a lung biopsy in order to detect that. But then soon after that, we started hearing more and started to look more closely at the data we had available to say, well, how big a problem is this? What are we dealing with here? And it was both the VA and the Department of Defense were starting to look into that and try to figure out what's going on.
From what I know now to then, I think like if I was to go back and repeat everything now, I would definitely be more cautious on how I was breathing
Mhm.
and what I was breathing in back then. I mean, we just didn't think it was an issue.
Yeah, I
Well,
also think that it's also like the hierarchy of needs, right?
Oh yeah.
At the time, you're more than likely just worried about survival,
Yeah, yeah,
right?
oh yeah.
We're worried about other things. It's an afterthought. What it is I'm really breathing. Am I really gonna make it to tomorrow? Like one of
Mhm.
those things is kind of weird. But you're right. I
Well,
think being conscious of what we can do now will help the future,
yeah,
right?
absolutely. And I do think there's been some learning that's happened. I mean, yeah, to your point, bullets kill faster than burn pit smoke, right? I mean, if you're dodging bullets, you're not going to be thinking about, well, should I breathe deeply or should I put a mask on or something,
Right. Yeah.
But I do think there have, certainly, I think there's a group of us that have really invested a lot of time and energy thinking about, well, what could you do? I
Mhm.
actually, this is another research story. I was at a meeting in Canada, and somebody was presenting a poster about how they were trying to monitor. It was a peacekeeping mission, I think, in Sudan, the Canadian peacekeeping mission, and they were trying to monitor the air quality at their base. And you're reading through this. Posters are very structured. You have your background and your methods and your results and your conclusions. And they get to the results section, and they're like, "Well, we were unable to finish collecting data because we had to get the heck out of Dodge because we were a peacekeeping mission and the antagonistic forces were coming and we
Yeah.
couldn't do anything
Right.
except evacuate. So they're like, unfortunately, we couldn't finish collecting our data. And I'm like, I took a picture of it because I was like, yeah, this is the real world.
Yeah.
This is you sometimes can't get the information you need to do a really good research study because you have another mission. You've got a
That
primary mission that you got to
makes
take care of.
sense. I
Mhm.
mean, it makes sense. You see results, the end.
So, well, what advice do you have for vets who are dealing with this, or besides, I mean, we've said make sure you get involved with the VA, make sure you see a primary care physician, but have you seen anything else that works that helps alleviate some of the pain or mitigate some of the?
The problems. Yeah.
Mhm.
So I would say definitely talk to a provider, to a physician about it. Definitely advocate for yourself to get an evaluation. So, I think sometimes healthcare providers you'll say, "Oh, I feel more short of breath." And they'll be like, "Oh, well, you've put on 5 pounds," or, like, "Oh, you're getting older."
Yeah.
And probably that's contributing to it, right? But I would say that for somebody who's been deployed and really experienced, the poor air quality of their theater, whether, it's even just industrial ambient air pollution in Kabul or something like that, or whether it's, No, I was stirring the poop pot, and I had to breathe that every day for a half hour or something because I was a bad boy, and they made me do it. And
45.
or you were running around that massive burn pit in Balad, whatever that exposure was, go ahead and ask for some sort of lung function evaluation, like a pulmonary function test, or we call it spirometry, just to get a baseline to see where you are. And certainly, if you're having any symptoms, you need to get that evaluated, and that usually involves a pulmonary function test where they see how much air you can breathe in, how fast you can breathe it out, and we use some standardized values to make sure that you're within the normal range. Sometimes they'll recommend some sort of imaging, like a chest X-ray or a CT scan of the lungs. And then, aside from that, avoid any other toxic exposures. So the most obvious one is smoking or any other inhaled substance. It's just,
Vape.
Yeah.
yeah, it's just not good for your lungs. And certainly, if you fear that you have some health effects from something that happened, you want to minimize any additional damage that happens.
Definitely.
And I think we are living in a world where we're seeing more. The history of the 20th century, the air and the water got cleaner, and now we're starting to see perhaps that with wildfires becoming more common and these sorts of things, that some of the air quality is deteriorating again. So I don't know, maybe you need to avoid some of the bad air quality days, or restrict your activities on those days. But those are some of the things you can do. I would also say just pay attention to some of the research findings. I do think as we make some of these connections and really answer some of these questions, not just about whether they're related, but more about how they're related and what's actually happening inside the body. We may come up with more targeted sort of interventions or treatments, or something that we could recommend. Staying physically fit is really important, even for people regardless of the cause. But there's pulmonary rehabilitation. So if you're getting to the point where you're really feeling like, yeah, it's hard for me to walk a block or something like that, you talk to your physician about getting some sort of evaluation, and then maybe doing some sort of rehabilitation to get back into shape and optimize it.
Why'd you look at me?
Why
man?
you keep looking at me, man? I mean, he's not your doc, but I'm letting you know that I did speak to a doctor, and he did say,
You know what? We spoke before we went live, and I was like, I'll put on the sweater because I'm gaining weight.
I'm surprised it's not the black one. Yeah, I think that's kind of what I was hoping to get to.
Mhm.
I think there is a lot that we can do with our providers, but at the end of the day, you gotta getting healthy and being physically fit, getting mentally evaluated, taking care of your mental health. Also, just my personal belief. I'm not a physician. Helps with a lot of that too.
Mhm.
Especially if it's pulmonary, right?
Mhm.
I mean, there's things and exercises that we can do to control our breathing, and I think there might be some exploration there for others who are listening.
Well, it's another historical medical history in tidbit. So back before we had really good treatments for asthma, there was a whole field of treatment around psychological interventions to manage the symptoms of asthma. So, asthma is a very physical disease. Your airways get obstructed, they get smaller, and you can't breathe air in and out as well because of the physical obstruction. But they used to train people to practice their breathing and control their breathing so that they wouldn't panic, basically,
Oh, yeah.
when you have that air hunger sort of thing.
Yeah.
So yeah, I mean, a lot of symptoms can be managed better with a healthy, outlook and kind of healthy mental health
Right.
kind of approach.
Good. I like that. I want to thank you and recognize you for coming on. Really appreciate it. I think when we first spoke, several months ago, I was excited. I was really excited to have you on, and this conversation has well exceeded all my expectations.
Oh, good.
It
Good.
definitely
Right?
has.
So
And
maybe I'll be invited back then.
Yeah,
huh?
absolutely.
Okay.
Absolutely.
I-
I'd love to hear more because I know how curious you are about the
Yeah.
research, and I can see you really are excited to start doing some of it. So I'm
Yeah.
excited to hear some of the results.
No, definitely. He's been excited about this interview for a good while. He's been talking about it.
Yeah, I have.
Yeah. So definitely, I feel like this interview was a lot of useful information. It wasn't just, talk and words going over our heads. It was useful.
Yes. And there's I do want to wrap up and end with my last question that I always ask all of our guests is pertains to Charlie Mike. So Charlie Mike for us means continue mission, right? So what does Charlie Mike mean to you?
Oh, I've got a whole bunch of stuff I need to do. I
I
think there are a couple of things that I'll highlight. So I've got a Gulf War illness project, and we are on the cusp of kind of looking at the genetic risk factors for Gulf War illness, and then looking at the interaction between the genetic risk factors and some of the exposures that Gulf War veterans experienced. So stay tuned. I'll let you know when that's ready to come out, because I think that would be exciting to talk about. I also I'm working with the Airborne Hazards and Burn Pit Center as a Center of Excellence at the New Jersey War-Related Illness and Injury Study Center. And I'm really excited about kind of bringing together some of the work we've been doing on how do we do it better? How do we get clinicians to speak to the veterans about the burn pit exposure concerns in a more effective way, and improve the veteran experience of that. And I think we have some really good initial work that we're going to be pulling together, and really going to be ready to share that. And then finally, I mentioned that data and biorepository commons, which is a little more researchy, esoteric, but I think just this idea that the VA and the DoD are sitting on pretty large amounts of information that just haven't been utilized to answer these questions, and kind of putting those to work for us, for the veterans to really understand the science, and then also understand what we can do better. So I think those are at least 3 things that I have to do in the next
That's amazing.
couple of months.
Yeah. So he has a clear mission. He is ready to take it on. And
definitely.
it's I'm going to say it's a little nerdy for me, right? But it really is exciting too, because I can see your passions through that. And it feels reassuring that even though for me it's a little out of my class, there are folks who are very passionate and love this really with the right intentions, right? I can feel your heart for service members, and anybody who hasn't been around you is lucky to do that. So thank you again for being here.
Yeah.
It's been phenomenal.
It has. It definitely has. I think you got another question, don't you?
No, that's it. What's my other question?
Books.
Oh,
That's
that's my
probably the man you want to ask.
one of my favorite questions to ask is, do you have any recommendations for books that we can follow? For me, I read all the time. I try to. Any books that you like turn to often? Like, this is the book that I recommend the most, or this is the book that I read often.
I don't know that I've reread too many books. I'll tell you one that has stuck with me. I think it was called Genghis Khan, but I read a book about Genghis Khan, and I just thought that was the most amazing story ever, of how that one individual kind of changed history. I thought that was fascinating.
I have heard that before. Recommendation. I think it was on Tim Ferriss's podcast.
Yeah.
Genghis Khan.
That's awesome. I didn't expect him to say that. That's awesome.
I don't got anything else. Oh, I do. One last thing. How can a veteran stay involved with what you're doing? I think what's great about this is we have a platform for folks. Like you said, you do have research coming up. How does somebody stay in tune with what's going on?
I wish I had been better prepared. So I do have a Twitter handle. It's at doc4 deployed. And it's been inactive for a few months, but I have been planning and plotting to kind of get it active again.
You said it. Now they're going to be wanting it.
Yeah,
okay,
right.
so I'll
you've got about.
I better get it. I better get something posted.
You've got about a month. You've got about a month. Okay. So it's at doc4 deployed.
Yeah.
Okay, that's awesome. I'm definitely.
I love it. No, that Twitter handle is
yes.
something.
I love it. That's right.
Yes, sir.
Go ahead, Raul.
Hey, with that, sir, honestly, we want to say thank you for coming on the show. We really appreciate you taking time out of your day to come in here and speak with us, and just breaking it down for us. We really appreciate it. And thank you for the work you're doing. Honestly, like it means a lot. to combat veterans. It definitely does. And, you're taking care of our brothers and sisters, especially, I feel like a lot of our older Vietnam guys
Yeah.
definitely will benefit from the work that you're doing. Well, as well as, ours, but I got the chills.
Yeah. I like talking about them too.
Yeah, but with that, we just wanted to say thank you, and we really appreciate it, and we look forward to having you back on the show.
Yes.
That would be my pleasure.
Awesome. Hey guys, with that, y'all be sure to follow, share, like, subscribe, and as always, you guys, Charlie Mike.